Good afternoon, and welcome to Raphal Medical Centre. Today, we're going to have a talk on the importance of oral health. The importance of oral health. In our country, awareness rather than oral health is very low. So we are doing our very best to increase awareness oral health amongst the Ghanaians. Outside, most people are registered with the insurance and companies, and from time to time they get letters informing them of the need to visit their dentist for a dental checkup, have their normal screening also done for them. So we're trying to increase awareness and also bring to you why we think oral health is important. And usually there are a few recommendations that we do as dentists. Usually we expect that the layman should be able to visit his dentist twice a year. That is every 6 months. So this 6 monthly visits gives us the opportunity to screen you, and then we check to see if you have any form of pathology. When I say pathology, I mean tooth decay, and then plaque, bad breath, and what have you. We also have oral cancers. Okay, oral cancers usually arise in the mouth, and then most people are not aware. So your 6 monthly visit to the dentist enable you to have all these things checked. So today I'm going to walk you through why oral health is important, and then what you can do to maintain a good oral health. And then lastly, I'll be hoping to take questions from all over. So please kindly give me your attention. Anyway, my name is Dr. Wadhwani. Dr. Wadhwani, and I'm your dentist for today. I'm going to take you through oral health. So kindly give me your attention. So today we're going to look at I'll start with the anatomy of the mouth, okay? Anatomy of the mouth. So I'm sharing a screen, okay? It's a cartoonish character that shows the gums, and we have what we call the hard palate. So if you look at the screen, you see arrows pointing to different parts of the mouth. We have the gum, then we have the hard palate. The hard palate is also known as the roof of the mouth, okay? The roof of the mouth. Sometimes when you are eating fish, you sometimes have fish bones getting stuck at a particular part of your mouth. This is what we call the hard palate, or the roof of the mouth. And then beyond the roof of the mouth, or beyond the hard palate, we have the soft palate, okay? We call it soft palate because the tissues there are soft. Okay? So that part is the soft palate. And then sometimes when you look into the mirror, you open your mouth wide and then you look into the mirror, and then you shout, you notice something that is dangling all the way to the corner of your mouth. We call that the uvula. Okay? Uvula. And then next we have what we call the tonsils. I'm sure most of you know what the tonsils are. Most people come to the hospital, present to the hospital with severe pain in the neck. Okay? We call it tonsillitis. And if that becomes very severe, then you have to go in and have a surgery done to take out the tonsils. We call that tonsillectomy. Okay? And then next we have the tongue. Everyone knows tongue. Then we have the teeth. So we're going to start from the very first arrow. Okay, so the very first arrow is pointing to the central incisor. We call that the central incisor. Then next, we move to the next teeth. We call that the lateral incisor. Then next, we have the canine. And then from the canine, we have the premolars. The premolars, we have two of them. We have the first and the second premolars, okay? And then from the premolars, we have the molars. We have the first molar, the second molar, and then the third molar. The third molar is also known as the wisdom tooth. third one is also known as the wisdom tooth. So sometimes those people come to us complaining of pain. They're pointing to the last area. Okay, so usually the wisdom teeth. And sometimes these teeth can they might not come out into the mouth fully. Okay? Sometimes they are turned in a different direction, or they are impacted. That's what we call them. And usually, when it's impacted, you have a bit of your gum covering it and causes some form of pain or inflammation that we call, the term is pericoronitis. Okay, so when it becomes extremely painful, you have to visit your dentist. Then we check and see what we can do. If it's if the gum has covered most part of the tooth, then the best advice is to have that last wisdom tooth taken out. Okay, so that's just by the way. So I'll go through briefly again. So we have the gums, as you can see, and then we have the hard palate, we have the soft palate, we have the uvula, the tonsils, you have the tongue, then you have the teeth. There are different types of teeth. Some of the teeth are for cutting, others are for tearing, and others are for grinding. So the incisors, you have the central incisor, the lateral incisor, and then the canine. These are for tearing and sharing food. Okay. Then you have the molars. The molars are usually for grinding the food. And after that, once you chew your food, and then the tongue enables you to swallow. Tongue enables you to swallow. So next, I'm going to talk to you about the parts, the different parts of the tooth. Different parts of the tooth. Okay, so we have the crown. Okay, the tooth is basically divided into three portions. We have the crown of the tooth, and then we have the neck of the tooth, and then the roots of the tooth. Okay, so this is the tooth anatomy. The crown of the tooth is that whitish area of the tooth that is showing in your mouth. Okay? And then the root of the tooth is what you cannot see. That is situated in the bone. Okay, situated in the bone. And I'll take you through the different parts of the tooth. So the whitish area of the tooth is called the enamel. The enamel, and it's the hardest part of the body. Okay, the hardest part of the body. The hardest part in the human body, the enamel. And then next from the enamel, we have the dentine. The dentine is the yellowish area just beneath the whitish area of the tooth, the dentine. Okay. Usually, as you age, after so many years of grinding and chewing, the enamel, the whitish part, begins to wear off, and then the dentine begins to become exposed. That's just by the way. And then from the dentine, we have the pinkish area. Okay, the pinkish area is what we call the pulp. That's where we have the nerves and blood vessels coming through. Nerves and blood vessels coming through. So that is the pulp. And then also we have the gums also showing. So then we have the bone. You can also see the bone. Okay, so that's just by the way. Then next, I would like to talk to you about the cavity. Cavity. So what everyone knows, what most Ghanaians know as kaka. What most Ghanaians know as kaka. So usually, a cavity is a small hole that you usually see on the surface of your tooth. It usually starts as a dark discoloration. Okay? As a dark discoloration on the surface of the tooth. And so for those that don't brush regularly, and also in children that love lots of sugary stuff, a lot of sugars and sweets, are predisposed to having cavities. So for those that have poor oral hygiene or poor brushing techniques, those that brush usually just once, or brushing twice a day, they are predisposed to having a cavity in your mouth. Okay, so with time, these cavities tend to go deeper, and then with time you can see the progression of the cavity. Okay, so I'll take you through the stages of tooth decay. Okay, so on the upper left picture, you can see a healthy tooth. Okay, and then with time you have what we call plaque. Okay, that needs to build up around the tooth. This is due to poor brushing techniques or poor oral hygiene. Okay, and then to the top right is the beginning of decay. The beginning of decay in the tooth. Okay, so sometimes you can have the decay in between the teeth, or you could have it on the surface of the tooth, and then sometimes on the facial aspect also as well. Okay, so that is the first stage in cavity formation. Okay, so usually at this stage, that is the second upper right picture. It's usually the first stage. At this stage is asymptomatic. You don't have any pain, don't feel anything, so they'll not put the need to even visit the dentist. Then you still continue your same oral hygiene practices. I mean, you still be brushing once, you'll not be visiting the dentist in the 4 or 5 years simply because you don't started having any pain. So what happens? So we go to the lower bottom picture on the left. The lower bottom picture on the left. So that's when decay starts. The cavity gets bigger and then progresses to the part of the tooth we call the dentine. It progresses to the part of the tooth we call the dentine. Once it gets to the dentine, some patients will begin to feel, not every patient, some will begin to feel sensitivity, maybe when they take cold water or they take hot stuff or they take sweets. Okay, and the pain around this time is usually not very painful, it's manageable. And then with time, the decay progresses to the third part of the tooth. That's what we call the pulp. The pulp. And the pulp, as I mentioned earlier, is a place you have the nerves and the blood vessels. Once the decay progresses to the pulp, then the pain starts because you have the pulp, nerves, and then blood vessels. So you begin to have pain. The pain is usually sharp and very more painful at night. And as you take cold water, warm foods, it's very painful. Taking sugary stuff is very painful. And the pain tends to become more frequent than when it was in the dentine. And then there are a few patients who, even at this stage, still refuse to visit their dentists. And they resort to all forms of medications, Jebedol and what have you, painkillers. Some even go to the pharmacist and ask for what we call touche. Touche is not recommended by dental association. So it's strongly recommended that you visit your dentist usually at this stage. So what happens? So once you have the decay in the pulp, you begin to present with pain. You begin to present with pain. And then the infection spreads all the way down to the bottom of the tooth, where you have the roots. So we call it the periapical area. The periapical area. So I'll show you some pictures of teeth that have cavities in them, and those that have progressed to the bottom of the tooth. Look at that. We have here sorry, just a minute. So in the next slide, sorry, the next slide will be coming up shortly. Okay, so in the next slide, we have a cartoon character of the tooth with decay on the surface of the tooth. And then on the right, the picture is not very clear, apologies. It's a bit of what I mentioned earlier. So it usually appears as a stain. Blackish stain on the surface of the tooth. Blackish stain on the surface of the tooth. Blackish stain on the surface of the tooth. So I'll be showing you the next picture, which is much clearer. So this is how the cavity appears. Okay, it usually starts as a dark spot. Okay, and the cavity is situated in what we call the fissures of the tooth. Okay, so that is how the cavity starts. Okay, and at this point, it is not painful. At this point, it's not painful. And then in this picture, you have a tooth, okay? You have a tooth in which a lot of tooth extraction has occurred. The cavity has gone deeper, way deeper, and at this point, the cavity is in the pulp. So in such a patient, he will be experiencing pain. And such a patient will be having difficulty chewing and eating on this particular side of his jaw. Such a patient will also be having difficulty sleeping at night. Okay? So at this stage, usually we cannot salvage the tooth. So when the cavity is as huge as this, we have to extract the tooth. In the next picture, you have a picture of the front teeth or the central incisors. Okay, so this patient also has a cavity, which is affecting the central incisor and the lateral incisor. Some patients wait, some of them are scared to visit the dentist, and by the time they come in, so much distraction in the teeth has occurred. Okay, we try our possible best to restore the patient's teeth by doing various procedures, which I'll walk you through. Okay, So in this picture, you have a patient with a swelling. If you look closely, notice there's a swelling in the gum. Okay, we call it an abscess. It's a dental abscess, and simply because the patient failed to seek treatment when the cavity started and progressed all the way, and the infection ended up in the soft tissues, and so it became an abscess. And at this point, the pain is excruciating. When I say excruciating, I mean extremely painful. And the patient is not very disturbed, the patient can't sleep, the patient is stressed out. And even, believe me, even at this stage, people still, still don't turn up to the dentist, their dentist. And it can also progress to something worse, which I'll be showing you shortly. We call it Ludwig's angina. Okay, so you have here a patient with a huge swelling that is extending from one side of the jaw all the way to the other side of the jaw. Okay, and most of you, you haven't seen this before, but we have these occurring patients, and these patients are usually patients that have had, it just started as a cavity in the tooth. Okay, started as a cavity in the tooth, what you call caca. This is how it started. It's progressed all the way, went all the way down to the roots, and then with time it spread along the soft tissue. So for this patient, he can't open his mouth, he can't eat anything, he's having difficulty breathing, and at this stage, it's fatal. There are a few patients that we've seen that have passed on to glory because of a tooth. What actually happened is, at this stage, sometimes some of them get some form of advice from their relatives to go and see the herbalist, and they apply all sorts of concoctions, and they are given all sorts of herbs to apply. And they think things will go well. And then with time, the infection progresses, it spreads all the way down and then beneath the tongue. The patient can't open the mouth, can't drink, can't take anything, even liquid. And by the time they rush in here, we have to do an emergency surgery. Okay? So we do what we call an incision. Okay, so what the incision entails is that we make a small cut beneath the chin. Okay, that's creating some form of space. Okay, so the reason why the patient has the swelling is because the infection, or what we call pus. Pus is a form of fluid which stings a lot, and it's yellowish in color. And with time, the pus builds up all the way around the chin. Okay, so we as dentists, we come in and then we make a small incision here, which is going to create some form of space for drainage. Okay, and so we set, you can see the dentist inserting his needle here to drain out the pus. So once the pus is drained out, the swelling then reduces, and the patient becomes comfortable. The mouth opening becomes better, and the patient is able to start eating and then drinking fluids with time. So as you can see, this is what a cavity in the tooth has led to. The patient refuses to seek treatment from the dentist. And when they come at this stage, some of them come and it's so late, and some of them pass on. I've seen patients die from this. So These are one of the reasons why you need to take your oral health. It's very important. Also visit your dentist twice in a year, that is every 6 months. When you come in, screen, we check, we do any cleaning. If there's any form of cavity, fill it. And then once you have your cavities filled, you avoid all this. So here's this picture that you see. This has a small cavity on the tooth. It's a small cavity. This is what it has progressed. So by giving you this information, I hope we are increasing awareness, the need for each visit twice every month. So I've been talking of the different types of dental fillings that we have. We have tooth-colored fillings, okay, tooth-colored fillings. And these are fillings that match the same color of the tooth. So once you use that type of filling, you don't notice any form of artificial color on the surface of your tooth. Okay? And then there are other fillings that have different presentations. Okay, we have some form of metallic fillings. We call it amalgam. I'm sure those of you that have fillings know what I'm talking about. Okay, we call it amalgam. Amalgam rather is one of the earliest fillings that was developed. Very strong filling, and usually recommended for the molar teeth, okay, the back teeth. The reason why most dentists use amalgam is because when patients talk, it's not visible. The molar teeth are usually not visible. So most dentists tend to go for the amalgam. They have high strength. Sometimes no matter what you are chewing or biting on, the amalgam fillings tend to be more superior to other types of fillings. We have the ladies who are very particular about the types of fillings they have in their mouth. They don't want anything that is going to give them any form of coloration in their mouth. So we use a particular type of filling that we call the composite. Okay, the composite is a tooth-colored filling. Tooth-colored filling. So when we use the composite, you don't notice anything in your mouth. Okay. Right. So next, talking to you about gum disease. Gum disease, or what we call periodontal disease. Gum disease is very, very common amongst us, and usually it starts with what we call plaque. And plaque is usually a thin film of saliva that contains a bit of bacteria and then food particles. Okay? Usually for those that have poor oral hygiene, those that are people that are not brushing regularly tend to develop what we call plaque. And then with time, as time goes on, the plaque continues to build up. So usually you see it in the mouth as a form of yellow coloration on the surface of the tooth. Okay? Yellow coloration on the surface of the tooth. So sorry about the picture, but I'm still increasing awareness. So this is a patient that I'm sure hasn't visited a dentist all his life. Okay, so you have a lot of plaque which has built up, and then with time the plaque becomes very hard, what we call calculus. Okay, and then what happens here is that a lot of gum distraction. Okay, the pink area is what we call the gum. Okay, a lot of gum distraction has occurred. And you also realize that there's receding gums. Okay, the gums are receding, or the gums are coming down. Okay, and it's exposing the roots of the tooth. So such a patient has a very poor oral hygiene. And trust me, this patient has never been to a dentist before. And with time, the patient is going to have mobile teeth. The teeth will start becoming loose. At the same time, the infection has progressed all the way to the bone. So the teeth with time are going to become loose and shaky. Okay, sorry about the picture, but I need to show you this. These are patients that we actually have been coming in once in a while. So this is a severe form of periodontal disease. This is periodontal disease at its severest form, where you have so much gum distraction has taken place. The teeth have become mobile. Some of the teeth will just be moving like the way I'm moving my finger when you try and shake them. This patient has very poor oral hygiene. Such a patient will present with what we call halitosis or bad breath. Okay? And awareness is even so low that people don't even know that's coming to the dentist solve all this. You know, no matter how much you brush your teeth, okay, you cannot take out the plaque or what you have in between your teeth, no matter how much you brush your teeth. So this is when you come to us that we use professional expertise in instruments or machines to clean out the plaque or the calculus. So as we go on, I'll be showing you a video, live video of us doing cleaning for a patient, moving all these things you have between the teeth. Okay, so in the next picture, we have the next picture. You can see something like a small machine. Okay, so this is one of our machines we use to remove the plaque or the calculus around the patient's teeth. Okay, usually the plaque, it builds up between the teeth and the gum. Okay, so you see it as a yellowish coloration around the gum. And we use our machine, we go in gently. It's not painful. We're able to clear out all the plaque. Okay, so usually when we tell patients to come in for 6 monthly visits, we usually do it routine. The cleaning is routine. So for people that don't visit the dentist, this is what they present with. Okay, so this is another picture which you have a patient that has he has a lot of stains, a lot of plaque. So this is before, and then on the right you can see that it's now clean and neat. The patient has seen a dentist and has had cleaning done. This patient now presents with good oral hygiene. Its gums are healthy, and usually encourage the patient to visit us every 6 months to have this procedure repeated. If the patient doesn't turn up, then the whole periodontal and disease process starts again. So in this picture, you could also see someone who had. So in this picture, you could also see someone who's had cleaning also done. Okay, this is before. You can see the stains and then after. So I'll be showing you a video shortly of cleaning that was done for a patient who also presented with a bit of plaque. So you can see the video is ongoing. So if you look closely, you can see a machine that is going, a machine which is going in between the teeth. So it's a painless procedure, and we're removing all the plaque or the tartar or the calculus. So this patient presented with a bit of bad breath and bleeding when he brushes his teeth. So in such a situation, we do what we call scaling and polishing for the patient. So what it does is our machine goes in between the teeth and also just above the gum to remove the plaque from the patient's mouth. And it's an entirely painless procedure. I know most of us are scared of visiting the dentist, but trust me, there is nothing painful. Most procedures are painless. Usually, for any procedure that is painful, we usually make sure the place is numb. We usually do some form of anesthesia so that you don't feel any pain. But with the cleaning, it's a totally painless procedure, and the video is not showing too well. So you can see there's improvement. You can see there's improvement. As you see, I was cleaning for this patient. I've been able to remove all the stains and all the plaque between the patient's teeth. So you can see with time, his oral hygiene is getting better. All the plaque, the calculus has come out. Yes, it's an entirely painless procedure. Please keep that in mind. So scaling and polishing of dental cleaning is not a painful procedure. And this patient was very relaxed, listening to some good music in the background and enjoying himself. So we cleaned and cleaned all the way to the back of his teeth. As you can see. So this is what your toothbrush cannot do. Okay, your toothbrush cannot go in between your teeth and remove the plaque from your teeth. So this is the need why you should visit your dentist. Obviously, when you eat, there are some food particles that get stuck in between the teeth. So it's the scaling and polishing that removes the plaque and the stains between your teeth. We'll be showing you another video of polishing. Okay. So as you can see, it's the same patient. So after I have done the scaling, the plaque, I'm doing some form of polishing on the patient's teeth. So what the polishing does also contains a small abrasive. Okay, it removes all the stains on the surface of the patient's teeth. So as you can see, patient's teeth are beginning to look brighter. And note, this is not tooth bleaching. This is not bleaching. It's cleaning. So we're removing all forms of stains and food debris from the surface and in between the patient's teeth. This is also not a painful procedure. And you can see the patient is relaxed, he's not shaking or moving around, enjoying himself and listening to some good music in the background. So it's some form of, you have some form of relaxation, you are lying down, and we take our time and make sure good cleaning is done. So the patient has opened his mouth, and I'm also cleaning the lingual aspect or the inner aspect of the patient's teeth. Once again, your toothbrush cannot reach into these areas to have the cleaning done. So you can see I'm doing it with my machine. And the patient was rather enjoying himself today because he hasn't done it before. And the areas that I'm cleaning also has some stains. So with the machine I'm using, I'm able to clean. After we're done, this patient had very good oral hygiene, and now he's able to smile while in public. And then after that, I did what we call flossing for this patient. Flossing, what we call the dental floss. Okay, so some people have very tight spaces between their teeth, very tight spaces between their teeth. People resort to using toothpicks, pick between the teeth, and in the process of doing this, traumatize or cause injury to their gums. Okay, so we recommend that you get the dental floss. It's a small thread. Some of them come with handles, and you just apply it between your teeth to have it clean. When you come here, we can also do the flossing for you to remove any forms of particles from your teeth. Okay, so as you can see, this is the surgery done with the patient. So taking you back, we continuing the oral health, the importance of oral health. And good oral health gives one the ability to speak, to smile, to taste, to chew, to swallow, to convey a range of emotions, and through facial expressions with a lot of confidence. Okay, that is what a good oral health enables you to do. So in the next picture, I'll be showing you a picture of someone who's lost a few teeth, not too many teeth. Usually, people lose teeth as a result of dental caries. Or, what I mentioned earlier, what everyone knows as caca. Okay, so sometimes they come to the dentist, and the only solution is to pull out or extract the teeth. For instance, this patient has lost 2 teeth, as you can see. And then, once again, as I said, we're increasing awareness. So some people are at home and they don't know that some form of treatment or replacement can be done for them to replace their missing teeth. So I'll be walking you through that. Then in the next picture, you also noticed someone who's lost just 1 tooth, just 1 tooth. He's lost one of his premolars. And then also a replacement can be done for such a patient. So we have different types of replacements. Okay, we have the movable replacements, and then we have the permanent replacements. The movable ones are what we call the dentures. Okay, so what this person is holding in his hand is called a denture. This is usually removable. As you can see there are a number of teeth on the prosthesis or on the denture. So this patient has lost all these teeth. And in order for him to be able to chew again and eat comfortably, he needs to wear this denture to be able to chew and grind his food effectively. Then we also have what we call the fixed prosthesis, or we call it a bridge. And we call it a bridge. And usually this is not removable like the denture. Usually fixes onto the teeth, and once we fix, it's permanent. It's a permanent replacement and cannot be removed. Okay? It's also has the same color as the teeth, and no matter the amount of teeth that you have lost, okay, you can still go ahead and do the fixed replacement for you, or what we call the bridge. Okay, so I'll talk to you more about the bridge. So what the bridge entails is that, for instance, in this picture that you've seen where the patient has lost one tooth, okay, this patient has lost one tooth. Okay. Such a patient has opted for the bridge and not the dental. He's opted for the permanent form of replacement. Okay. So what the bridge does is that you realize that the tooth in front and then the one behind, the one which has been lost, okay, has been reduced in size. Okay, so the one in front, the one which was lost, and the one behind have both been reduced in size. Okay, why has it reduced them in size? Simply because we need space to accommodate the bridge. Okay, so what you see up here, okay, it's called a bridge, and this is a 3-unit bridge. Okay, this is a 3-unit bridge. Simply because we have one part of the bridge and another part of the bridge providing support, okay, to the one in the middle. Okay, providing support or to hold the one in the middle in place to replace the missing tooth. So what is done is that the dentist just reduces the one in front a bit, then reduce the one at the back a bit, then the bridge is seated on those two. In the process of seating it, the one that was lost is also replaced. So in this picture, you can also see the patient has lost his front tooth, and in replacing it, a small reduction, that is the second picture on the right, was made, one on the left and one on the right. And then in placing the bridge, fix it on, as you can see in the third picture. So in the fourth picture, you can see the bridge has been fitted. It has the same size and the same color as the normal teeth. And once you do the bridge, no one can notice it. So in the next picture, I'll show you someone that has had a bridge. So you can see that the patient has a missing tooth in between. And the bridge was done for the patient. In the end, was placed on top, and he had his missing tooth replaced. Also, it's not a painful procedure, it's very straightforward. In the next picture, you notice a patient that has lost quite a number of teeth, okay, quite a number of teeth. And the dental bridge was also done for him. So as I said, small reduction is done. And then on the right, you can see the bridge has been fitted, and he has his normal teeth color, and everything is back. He can chew and speak and smile confidently once again. So he's had a dental bridge fitted for him. And then there are a few patients who come to us who complain of scarlet teeth. They have dark teeth, or one tooth, particular tooth is more yellowish than the other. So usually for such patients, we do what we call crowns. Okay, we fabricate crowns for them. And we have different types of crowns. We have some that are made of gold, we have some that are made of porcelain. Porcelain is usually tooth-colored, it's a tooth-colored material. And then we have some that are ceramic. So if you notice the Muslims, those that go to Saudi, when they go for the Hajj in Mecca, when they go and come back, there's some form of tradition to show that they have been to Mecca. So they usually come back with gold crowns on, usually you see it on their front teeth. So they've just had the gold crowns placed on them. So for those of us that have discolored teeth that are extremely discolored or badly broken down, we could have replacements done. Okay. We have what we call the crowns. So in the next picture, I'll be showing you the hand. So as you can see, the upper left, patient had a discolored tooth because it is dark. But after we fitted the crown on it, it's much the same color as natural teeth. So this patient has had a crown fitted for him. In the lower left picture too, the same thing. Notice the discoloration. After it was done, everything matched. Also in the next picture, you also realize the two central incisors on the left, as you can see here. This one and then this one were also discolored. And after we did it, you can see down, that's the bottom picture, you can see the crowns were fitted, and he had his normal teeth color back. Gain his smile and confidence to speak. Okay, So next, I'll be talking to you about dental braces. Okay, dental braces. It's also called orthodontics. So there are a few people that come in and they have, should I say, crooked or mal-aligned teeth. Okay, the teeth are not straight. They're not well aligned. This can also be corrected. Okay, this can also be corrected here at the Raphal Medical Centre. Usually corrected by wearing braces. Okay? So braces are simply some form of wires and what we call brackets that are placed on the surface of the teeth. Usually patients are told to maintain good oral hygiene whilst wearing their braces. So if you have very poor oral hygiene, you're not brushing well, we usually don't recommend braces for you until you're maintaining good oral hygiene practices. If you have the willingness to visit your dentist regularly, then we shall recommend braces for you. So what the braces do is that they tend to straighten and align the teeth. So you can see this very beautiful lady, who I'm sure sometime in the past had difficulty smiling and speaking in public. Braces were fabricated for her. And then if you look at the picture close, you can see some teeth have been formed or grown behind the other teeth. So what has been done is that the braces were placed on her teeth, and with time, it created more space, and then the teeth have had the chance to move forward and align themselves beautifully. So you can notice the marked transformation that she's had in her teeth, and now she's regained her confidence, and she can smile widely and speak with more confidence. And so usually the braces is usually worn over a period minimum 1 year. And during this period, we recommend that you come in and also have cleaning done. So there are some of you out there that have braces on your teeth. And usually recommend that you still come in and then have cleaning done, because once you have the braces, your toothbrushes cannot clean effectively because the braces prevent effective cleaning of the toothbrush. So when you come in for the scaling and polishing, the machine will go in between the braces and remove it, remove all the plaque, so that you don't have to have bleeding gums or any form of gum disease. So, talking to you about the braces. Thank you for your attention. At this point, I'll take questions from viewers. Once again, this is the Raphal Medical Centre. This is the dental department. My name is Dr. Wadhwani, and I am practicing dentist with the Raphal Medical Centre. And our working days are from Mondays to Saturdays. So from Mondays, Wednesdays, Fridays, and Saturdays, we work from 9 until 5 p.m. Once again, I said Mondays, Wednesdays, Fridays, and Saturdays. Our working times are from our working times are from 9 to 5, Mondays, Wednesdays, Fridays, and Saturdays. Then on Tuesdays from 2 to 5, Tuesdays and Thursdays from 2 to 5. We also consult.
Hello. Hello.
Hello.
Yeah, so I dropped some couple of questions in the chat. I don't know if you can just check the chat and then respond to those questions I asked. I didn't want to interrupt your presentation.
Sorry, come again.
So I dropped some couple of questions in the chat. So if you could reference the chat and answer some questions which I dropped there.
Okay.
Thank you.
All right. Okay, so you mentioned the quality of the audio being wasn't too clear. Sorry about that. And then your next question was, how strong is the dental bridge? Okay. So as I mentioned earlier, the dental bridge is a permanent. It's permanent, and it's very strong, and it's going to last you a lifetime. To last you for the rest of your life, okay? It's very difficult to, it can be removed. Once we fix it, we usually fix it with a form of cement, okay? It's cemented onto the adjacent teeth and it's permanent. It can be removed and it can function as the way as your normal teeth were functioning. So it's very strong and will last you a lifetime. It's much stronger than the denture. What can be removed. Okay, so the dental bridge is permanent restoration and it lasts a lifetime and very strong. So once the dental bridge is fitted for you, you don't have any problem whatsoever. So it's a very good recommendation as opposed to the bubble type. So for that one, dental bridge is very strong. Okay, the next question asked was, what is the composition of the artificial tooth being used? And is there any health implications in the procedure? What form of maintenance should be done? Okay, all right. This is a very good question. Okay, so for the artificial teeth, we have different types of material being used. Okay, they vary from acrylic, porcelain, to ceramic, to gold, and then to metal. But for the dental bridge, what we're using is porcelain. Okay, and this porcelain is fused to metal. Usually, the porcelain fused to metal gives it higher strength, okay, as opposed to other materials. So for the dental bridge, we use the highest grade of porcelain for you. It has metal fused to it on the inside. So that's the composition of the artificial teeth being used for the dental bridge. Okay, but for the denture, we use acrylic. And then you ask if there's any, you ask if there are any health implications in the procedure. And there are very few health implications in the procedure. And usually for those that have high blood pressure or for those that are diabetic or have any form of immunocompromised, any form of immunocompromised states, we usually try to make sure they are on their medications. We try and up their oral hygiene for them. And once the oral hygiene is in good condition, then we can go ahead and do the procedure. Okay. And you're asking what form of maintenance should be done. So for those that have some form of artificial teeth or have dental bridges or dentures, we give instructions to such patients. We still strongly recommend that you should visit your dentist every 6 months, okay, to have routine dental cleaning done. And once you come in, we're able to check and make sure your bridges or dentures or what form of artificial teeth you have is in good condition. Then we go on to do any form of advice. And then you ask if there's any special toothpaste or toothbrush for people that have dental bridges or artificial teeth in their mouth. Usually the toothpaste that we recommend is to have fluoride, okay? And what usually recommend is the Colgate. We also recommend Pepsodent. We also recommend so Colgate, Pepsodent, and then we have the Oral-B toothpaste. And we also recommend Close-Up. So far as the toothpaste contains fluoride, they're good to go. And then you asked about the brushes. So we as dentists usually recommend soft bristled toothbrushes. Okay, some of you go for very hard toothbrushes, thinking that the hard toothbrushes do a better job, but they usually cause a lot of damage to the teeth. Okay, usually cause tooth wear and gum recession. Okay, so we usually advise our patients to go in for soft toothbrushes. You ask, how do I book an appointment? Oh, that's very straightforward. All you need to do is just, we work from Mondays to Saturdays, okay? On Mondays, Wednesdays, Fridays, and Saturdays, the dental clinic is open from 9 a.m. to 5 p.m. You can walk in during this time, and then you can see the dentist. You don't need to book an appointment. Once you walk in, you'll be attended to. And also for those of you that can't make it on these days, you can walk in Tuesdays and Thursdays, but the times of these days is from 2 p.m. to 5 p.m. So if on Tuesdays or Thursdays are less busy, you could walk in from 2 p.m. to 5 p.m. and the dentist will attend to you. And if you choose to come in on Mondays or Wednesdays or Fridays or Saturdays, the times are from 9 a.m. to 5 p.m. So kindly take note. We're putting this on the platform. So just pay attention on our platforms and you take note of the times. Okay, Kojo says, and thank you for the presentation. You said I've been experiencing painful loose flesh at the inner part of my gum. Okay, so I think as I was going through the presentation, I spoke about that. The loose flesh you have at the inner part of your gum or the tooth, call it the operculum. Okay, operculum usually located around the wisdom tooth, and with time it becomes painful. So in such situations, if the pain is bearable, what we usually advise is that you come in and have dental cleaning done. We prescribe some antibiotics for you and a mouthwash. And depending on how big that part of the loose flesh is, I think things can be done. We can do something called an operculectomy to remove the loose flesh, and then your symptoms will get better. Okay, but in situations where, let's say you have an impacted wisdom tooth, the loose flesh tends to cover the whole wisdom tooth and becomes very painful. And at this point, you need to have some form of surgical removal of that tooth, which is also done here. So that's about it for painful loose flesh. That's from Kojo. Toby Obi asks, what is the cost of, what cost implication to, okay, how much the bridge will cost? I think that's what you're asking. So it depends on the number of units of the bridge. Okay? So for a single unit or for the crown, okay, the crown, that's about 745 Ghana cedis, okay, for the crown, and it's a permanent replacement. Okay, that's why the cost is 745 Ghana cedis. And then we have, based on the number of teeth we are replacing. Okay.
Excuse me, can you recall the cost again? I didn't get that. It wasn't clear. How much does it cost to obtain the dental bridge?
The dental bridge.
Loose tooth of like 3 on the left, on the left side, and 2 on the left side, making 5. How much could that be?
Okay, so you said 2 on the left and then 2 on the right.
Correct.
Okay, so so if we are making a dental bridge for you, so if we're replacing 2 on the left, then the bridge will be it will be a 4-unit bridge. Okay, because we are replacing 2 on the left, you need 2 other teeth to provide support. So it's a 4-unit bridge. So that would be 745 Ghana cedis times 4, because it's a 4-unit bridge. Okay, so if you're doing 2 on the left and then 2 on the right, I'm sure you can now make the calculation. But we'll not do the 2 at the same time. We do one side, and then after a period of time, then we do the other one on the other side, so that it's not stressful, and then you have time to adapt to it. Okay. So it's 745 Ghana cedis for a unit, and since you are doing 2 on the left, it's a 4-unit bridge. So that's 745 Ghana cedis times 4 for the one on the left. So if you're doing another one on the right, you just double the amount and then you have it. Is that okay?
All right, thank you for the information. So what is the procedure painful or painless?
Okay, so before we do any form of invasive dental procedure, we usually administer what we call anesthesia. Okay, anesthesia is simply getting the whole place numb so that the procedure is painless. Okay, so we just numb the area. So while we're doing the procedure, you don't feel any form of pain. Okay, so it's a painless procedure. So you don't have a problem doing it.
So how long does the anesthesia last? Because the last dental operating I did, the anesthesia weared out in the process, and I kept on feeling the pain. But since they've gone this far, they couldn't stop. So how long does anesthesia last when they inject that in tooth to the gum?
Okay.
That is what scares me about the procedure.
Okay. Very good question. Very good. So sometimes it depends on the amount of anesthetic solution that was injected into the area. Okay. So usually what we do here is we inject one side, that's the outer aspect, and then we inject the inner aspect. So usually it will last over an hour. And even when you get home, you still have the numbness. So once we give you the anesthesia, it could even last up to 2 hours. So you don't have a problem at all. don't have a problem at all. So during the procedure, you shouldn't have any form of pain during the procedure. Is that okay?
Sir.
Yes.
Please, when you are cleaning the teeth, will you use anesthesia?
Cleaning of the teeth is not a painful procedure. It's not a painful procedure. So we usually don't use anesthesia. But for the young people, like we have a spray, okay? We have a spray that we spray around the gums, okay? So that if you're even scared, I mean, your teeth, the gum area will all be numb. So you shouldn't be afraid, okay? It's not painful when you're cleaning the teeth. Okay, you don't need anesthesia before you clean your teeth. Okay. But if you're scared, we have a nice spray that tastes like mint or toffee that we spray around your gums. Okay, so it even makes the whole procedure pleasant. Okay, so cleaning is a painless procedure.
All right,
So please, when you're
all right, go ahead.
so please, talk, master, talk. So please, when you're coming for the cleaning, how much will we pay for one person?
Okay, how old are you?
Okay. I'm 12.
Oh, okay. So if you're coming for the cleaning, it's 138 Ghana cedis for you.
Is it the cost that it comes with the age?
Yes, it comes with the age.
So us,
Okay, so for the young people, okay, it's 138 Ghana cedis, and then for the adults, it's 230 Ghana cedis for the cleaning. Okay, and all you need to do is just do it twice a year, every 6 months, twice in a whole year. And once you're doing it, you should be fine. You shouldn't have any cavities or any gum disease or bleeding when brushing. Is that okay?
All right, quick one. Just one more question from me before I leave the room. So after the procedure has been done, do I feel any form of discomfort after the anesthesia has wear out? Or will it just be a smooth operation whereby I do not feel any other pain when I get home?
Okay. Very good question. You're asking very salient questions, and I really appreciate that. So after we fix the bridges, okay, after the bridges have been fixed, usually you've lost, I mean, the teeth might have been lost over there for maybe 2 or 3 years, and you have something new in your mouth, okay? So usually before you leave us, we make sure you put your teeth together, or you occlude your teeth to make sure you have your perfect bite, okay? So you don't have any form of discomfort when you put your teeth together. So we do all these check-ins before you leave. And then we also usually prescribe a few things, a mouthwash also for you to maintain your oral health and your gums. And then for patients that have dental bridges, it is a strong recommendation that you continue to visit us to have cleaning done, professionally, so that you don't have plaque building up around your bridge or any form of caries developing around the bridge. So you still continue to visit us even after the bridge has been fitted. And there are very few or no complications at all associated with the bridge after the procedure has been done.
So one more question. Sorry, I'm asking more questions. So after the operation has been done, I do not feel anything. Do I get to eat with it on the first day, or do I go on a special diet for that first day before using the bridges?
Okay, that's also a very good question. So after the bridge has been fitted, you can, that very same day, you can go ahead and chew comfortably. You actually make sure you are able to put your teeth together comfortably before you leave, so that when you go home and chew and do whatever you're doing, just like you had your teeth over there before. So we check all those things before you leave. So once you get home, you can resume any normal activity. There are no form of restrictions after the dental bridge has been fitted.
All right, I rest my case.
Thank you very much.
Doctor, good afternoon, and thank you very much for the exercise. I just want to ask a question that I've seen some people with the bridge on, and you can see that the bridge is discolored. What causes this?
Okay. So
Thank you.
So I'm sure you've seen what the dental bridge looks like. For the discoloration, I don't know what exactly form of discoloration that you're talking about, but cases
Normally
where you
growing
have
darker.
darker.
Yeah.
Okay. So in such situation, then you might have the porcelain or the covering of the bridge chipping off, basically because the patient or whoever has the dental bridge is using wrong forms of I don't know, it could be mouthwashes or using very hard, extremely hard bristled toothbrushes. And also, you're not supposed to subject it to extreme forces, like bones and other stuff. But it's very rare to have discoloration of the bridges. It's extremely rare. It's extremely rare. And it also depends on the type of material that was used for the bridge. Okay, so where you have a patient using the porcelain type of bridge, very rarely do you have discoloration. Okay, and then we also have bridges that are made of acrylic. Okay, the bridge can be made of acrylic material, and in this type of bridge, you could have discoloration. So in this type of bridge, you could have discoloration. Okay, there was a patient that had an acrylic bridge done for her, and then with time, the color changed, got more yellow. So she came to see us and advised that she change from the acrylic type of bridge to the porcelain. Okay, so maybe the ones you have seen is the acrylic form of the bridge, but with the porcelain type, very rarely do you have any form of discoloration. That's a very good question. Thank you.
Thank you.
So, doctor, quick one.
Yeah.
What is your suggestion to, or let me put it this way: can anybody get these bridges? And if yes, what's your advice to someone who is on the 70 to 75 years old trying to get a bridge? Do you advise that the person gets it?
Please, can the question come again?
All right, so I'll place it. The bridge, can anyone get it? And if yes, anyone can get it, what is your advice to someone who is 70 to 75 getting a bridge done?
Okay. That's a very good question. So usually for those that are 70 years and over, unless that person has a very good oral hygiene, this person is not having any form of gum recession, and the person has a lot of standing teeth, then and the person has any form of underlying illnesses, maybe like diabetes or any form of immunocompromised diseases, we could go ahead and do a dental bridge for such a patient. But most of 70 plus patients usually have receding gums and a few mobile teeth here and there, and usually because they are aged, we usually recommend the dentures or the removable type for such patients. So we have a few 70 plus patients who come in here, and then when we check their oral hygiene, we realize their oral hygiene status is good. So we go ahead and do the dental bridges for them. But a large number, that is of the 70 plus, have rather poor oral hygiene. And also the one thing with the age is that, as you age, the teeth tend to wear down with time, and some become more sensitive and all that. So for such patients, we usually recommend the removable type of teeth for them, that's the denture. So if there's someone who is 70 plus that wants to have the bridge done, we need to do a full and thorough examination and check the patient's oral hygiene status. Once we have more ticks than crosses, then we go ahead and then do the the bridge for the patient. And if the patient doesn't have any underlying condition like diabetes or any other form of immunocompromised states, we can also go ahead and then do the bridge for the patient. Is that okay?
Thank you very much. This is clear. And also, one more question, and I asked too much of questions, but knowledge is power. So, I do my bridges at the age of, say, 35, and I get to 70 years old where my teeth are still receding, they start falling off. Will the bridges still stay, or will they fall off along with the teeth that are falling off?
Okay, that's a very good question. So if you have your dental bridges in place, I would strongly recommend that you are visiting your dentist regularly. Sometimes I'll even move beyond the twice yearly to 3 times a year, maybe at the beginning of the year, the middle of the year, and then the last part of the year. To have usually those that have dental bridges and other forms of artificial replacements in their mouth have to have more appointments with the dentist than the regular patients. Okay, so it's during this visit that we check and make sure your oral hygiene is up to par, and then we do the professional cleaning for you. We recommend mouthwashes, recommend special toothbrushes, the incremental type. Then your bridge should last you a lifetime. But in situations where you don't visit your dentist for 3 to 5 years, a lot of deterioration can occur. You could have food packing at a particular place beneath the bridge, then can cause distraction of that tooth, or that particular tooth that is providing support for the bridge. And once that happens, then the bridge becomes weak, and then it falls off. Okay, there have been a few instances where we had such cases. So the recommendation I give to you is to just regularly visit. If you are doing twice a year, that's fine. Yeah. Is that okay?
Yes, that is it. Thanks.
You're welcome. Okay. Kojo says, I often bleed when brushing my teeth. What can be done to avert it? Okay. So as I was going through the presentation, bleeding during tooth brushing usually occurs from, usually is due to the result of the plaque or the calculus or the tartar that builds up in between the teeth. So what usually happens is that whilst you're brushing, the toothbrush attempts to take that off, and in the process, you bleed. Another reason for the bleeding is simply because gum distraction is going on. Sometimes you wake up in the morning, when you spit, you find blood or drops of blood in your sputum, simply because of gum disease. So you're asking what can be done to avert it. Aside your regular brushing, that is twice a day, you should also visit your dentist. And I'm strongly emphasizing that at least twice a year, and then we remove what your toothbrush is able to remove. That is the plaque or the tartar or the calculus. And that's causing the bleeding. And then once that is removed, prescribe a mouthwash. Then with time, the bleeding subsides and you're okay. And Ifri says, thank you for insightful information. Please, how can I tackle bad breath in a 7-year-old child who brushes twice daily? So bad breath is also known as halitosis, and there are various causes of bad breath. Bad breath could arise from 4 brushing techniques. There are people that brush their teeth without brushing their tongue. Okay, and the tongue is also a reservoir for food substances. It contains very small pores, okay, where food particles can settle. If you brush your teeth without brushing your tongue, you still have bad breath. So usually that's what happens in the kids. Okay, and then maybe if the child has a carious tooth, what most people know as caca, or a hole in their tooth, that could also result from bad breath. And also your choice of toothpaste also has a big role to play. Okay, a big role to play. And if you notice your child has bad breath, why don't you book an appointment with the dentist, check it out, and see what exactly is causing the problem? For the elderly who have bad breath, a couple of factors are responsible for it, ranging from tooth decay to gum disease to smoking and drinking, and then other disease conditions can also contribute to bad breath, ranging from stomach ulcers to vast majority of illnesses and ailments. But once you come into the hospital and book an appointment with the dentist, you're able to tackle and find the root cause of the bad breath and then solve it. And then, okay. Someone said he's experiencing very painful loose flesh at the inner part of my gum, and how do I address it? I often bleed when brushing my teeth. Okay, so I think I've already addressed both situations. I said if you have very loose flesh at the inner part of your tooth, it's inflammation, and you come in and then we look exactly at what is causing the problem, prescribe antibiotics, and then if some form of intervention has to be done, the dentist will do it, and then I think the problem will be solved. Okay. From Frank says, are there harmful effects to use for the use of fluoride? So usually there's a particular range of fluoride concentration in our drinking waters, and we're not supposed to exceed a particular limit of fluoride. And usually especially for children who are still growing up, and then fluoride also contributes to tooth formation. So where the amounts of fluoride exceed the recommended allowance, then it has detrimental effects to the teeth. So we have people that have what we call fluorosis. And fluorosis is also known as fluoride toxicity. It affects the teeth and also the bones. So yes, there are harmful effects of fluoride. But in our toothpaste, the amount of fluoride in the toothpaste is the recommended allowance. So our toothpaste are safe to use. And it's usually the toothpaste without fluoride that tend to be detrimental, because we need some amount of fluoride to prevent tooth decay. So you have it. And I just say, what do you say about teeth whitening? How lasting and how safe is it? Okay, so teeth whitening is also known as bleaching. Okay? Also known as bleaching. The process involves applying some material to the surface of the teeth to remove the scarlet or the stained layer. Teeth whitening is not permanent, and it doesn't last forever. People who do it after a particular period of time, and with time the teeth color reverts to its normal color, and then you have to come in and have it done again. You asked about its safety. Okay, so since a layer of the tooth is removed, the more often you do it, the more likely you are to develop what we call tooth sensitivity. Tooth sensitivity. So a wide range of dentists don't recommend tooth whitening unless, of course, you have extremely bad discolored teeth. But for if you want to have the typical Hollywood smile that the actresses and actors have, they usually use what we call veneers, okay, porcelain veneers, okay, and these are fixed onto the surface of the teeth permanently, and then you could have the Hollywood smile that you're looking for. Okay? So for teeth whitening, it's not permanent, and the more you do it, the more likely you are to develop sensitive teeth. Okay. Edward says, how much is the gold teeth, and can one eat with it? And how much is still cleaning as well? Okay. I wonder why Edward wants a gold teeth. And, oh, of course, you can eat with it. And okay, and then we do the cleaning here. It's done here routinely. Thank you for your question. And then we forgot Frank says, how do you handle gum recession? How do you handle gum recession? So there are a variety of causes of receding gums, okay, stemming from periodontal disease, that is poor oral hygiene, to very bad brushing techniques, okay, and then the use of hard bristle toothbrushes, okay. These all contribute to gum recession. So in order to halt this process, we need to do a variety of things. First, you need to come in and visit your dentist. Then we examine you, and then we're able to tell what the cause of the gum recession is. So once we identify the cause, then we're able to solve the situation. Okay, so there are a variety of causes to gum recession. Okay. Raphal says the process of engagement with the public is truly amazing, and we're checking our website for more of such programs. Thank you, Raphal. And continue to update. This is just the first. We have more coming up. Okay. Thank you very much. So, so this is the dental department of the Medical Centre. We have the latest state of the art of the dental. We have the latest dental chair. So okay, so as you can see, this is our dental shelf. We have various components. So once the patient comes in, after being attended to, the patient comes in, then we have the patient sit into the dental chair. As you can see, then it's supposed to come back, please look up. Okay, so this is the position in which we have our patients. And then we have a working top, this is the dentist working top with all his instruments and the examination set. And then we have dental lights, which we use to examine our patient's teeth. So it's at this stage where the patient just, we tell the patient to open up, and then we have a look. We have a look into his mouth, and then see the condition of his oral hygiene, and then we go ahead and then do any form of treatment that needs to be done. Okay, so these are various machines. We also have what we use to do our suction. Okay, so while the dentist is working, the dental nurse or assistant is sucking out the saliva from the patient's mouth. So once the procedure is done, then the patient is told to sit up, and we have a disposable cup with purified water, and the patient rinses out and spits into the sputum bowl. Okay, so as you can see, this is a very comfortable and state-of-the-art dental chair. And usually we have the dentist working on the right side of the dental chair, and is usually assisted by the dental assistant or dental nurse on the left side. So during any form of procedure, have the dentist usually seated on the right side, like you can see I'm doing. Okay, and this dental chair can be automated. I'm able to move the chair back to assume a particular position. So I'm going to demonstrate it. Once again, I have the patient coming back. Okay, so he's now in a supine position. Okay, so I'm going to lift him into the incline. So in this particular stage, this particular position, there are some procedures that are done. And for other procedures, we need to move the chair up. Maybe during the extractions, we incline the chair, and then we go ahead and then do the procedures. We're also able to move the chair up way up. As you can see, the chair is still going up and up. So it's fully automated. And it's one of the latest types of dental chairs that we have. So you can see how high the chair is going. It's still going. And so even at this height, we're able to adjust and move the patient in all positions. All positions. Okay. So I'm bringing him back to the normal position, lifting him up, and then I'll bring him down. As you can see, he's coming down. Okay, and now he can safely come down. So this is the state-of-the-art dental chair, and one of the latest that we have in town. It's very comfortable and well built and crafted for the comfort of patients. So once again, as I said, the dental nurse assistant works on the left, then you have the dentist working on the right. This is the consulting area. So you come in, before you come in, I attend to you at the consulting area, whatever form of complaint that you have, and you make it, and then I document it. And then if there's anything that you want to know, so we have a screen here that also gives our patients more dental education. So some patients walk in and they don't know exactly what they need to do. So we give them a variety of things. So as you can see in this picture, this is someone that has braces being fixed. So we tend to educate the patients on what can be done in the different types of things that can be done from them, ranging from the fillings to the braces and extraction and all that. We educate our patients before we move them to the dental chair. So we continue to encourage you to visit the Raphal Medical Centre, and from the 17th of August to the 1st of August, we're having a free dental screening. And it's from Mondays to Saturdays. And from Mondays, the time is from 9 a.m. to 5 p.m. On Tuesdays, kindly take notice from 2 p.m. to 5 p.m. Wednesday, 9 a.m. to 5 p.m. And then Thursday, from 2 p.m. to 5 p.m. And then Friday and Saturday, from 9 a.m. to 5 p.m. Okay. So that will start from the 17th of August through to the 31st of August. So I hope you like our setup. And once again, I'm your dentist, Dr. Wadhwani, with the Raphal Medical Centre. And please, we're still open for questions. When I have lockdown.
Oh shit, I think I could back on what the center. The program to the record will
So we're still waiting to take any more questions. But I hope you enjoyed our presentation and tried our very best to increase awareness. Last year, we had some dental screening done, and through the screening, we were able to increase awareness. And we're doing the same this time around. Increase oral health awareness, and it's my hope that patronize our services. And then the strong recommendations I made earlier that it's very important that you visit your dentist every 6 months. Every 6 months. And once you're visiting us very often, you have ability to have your oral hygiene checked, and any form of pathology is dealt with before it develops into something else. So thank you very much for your time. It is my sincere wish that everyone will patronize the screening session that we'll be having from the 17th of August through to the 31st of August. And once again, I'll go through the times again. So on Tuesdays and Thursdays in particular, the times are from 2 p.m. to 5 p.m. Tuesdays and Thursdays, so kindly take note. Then from Mondays, Wednesdays, and then Fridays, and then Saturdays, from 9 a.m. Kindly take note of these times, and please avail yourselves to take opportunity of the free screening session. Thank you very much, everyone, and please stay tuned for the next update that we'll have concerning health in general with the Raphal Medical Centre. Thank you.